Okay, so I think we'll begin today's webinar. Distinguished colleagues, representatives of member states, partners from across the United Nations, the IFRC, civil society, academia, technical institutions, and friends. Good morning, good afternoon, and good evening to all of you joining from across the Asia-Pacific region and beyond. I am Rudrajit Das, UNICEF's lead on demand for immunization for the Asia-Pacific region and co-chair of the Asia-Pacific Community of Practice on Community Resilience and Engagement, which is co-chaired by WHO, IFRC, and UNICEF. It is my great pleasure to welcome you all to the launch of this Community of Practice. Today marks an important step in our shared efforts to place communities at the center of public health emergency preparedness, response, recovery, and long-term resilience. Over the past several years, our region has faced repeated reminders that public health emergencies are not just technical events. They are deeply rooted social events. Disease outbreaks, disasters, misinformation, disruption to services, and pressures on health systems all unfold in communities. They unfold in households, schools, workplaces, places of worship, markets, and even online spaces. The effectiveness of our response depends not only on the strength of our surveillance, logistics, clinical care, and policy systems, but also on whether people are informed, listened to, trusted, engaged, and able to act. This is why community resilience and engagement are so essential. They help ensure that preparedness is locally grounded, that response measures are practical and acceptable, that services reach those most at risk, and that recovery strengthens systems rather than simply restoring what existed before. They also strongly remind us that communities are not just passive recipients of information or assistance. They are leaders. They are problem solvers. They are first responders and also partners in protecting health and well-being. The scope of this community is intentionally broad because of the work that we do. The work on community engagement and resilience cuts across many areas. It includes risk communication, community engagement and resilience. It includes surveillance, demand for immunization, workforce strengthening, infodemic management, social and behavioral sciences, and even measurement, evaluation, and learning. Now, these areas may sit in different teams or institutions, but in practice, they are closely connected and they are strongest when we work together. So this community of practice will provide a platform for coordination, peer learning, joint problem solving, and practical support. Through its secretariat, technical advisors, the digital platform, and agreed priority initiatives, we expect that we will be able to share guidance, tools, training opportunities, resources, lessons learned, and evidence. It will also support collaboration before, during, and after emergencies, including coordinated planning, surge support, knowledge management, and regional advocacy for community-centered approaches. But like all practices, the success of this will depend on all of us. A community of practice is only as strong as the practice that its members bring into it. So your country experiences, operational lessons, technical questions, the innovations that you bring, the challenges that you faced, and your honest reflections will really help this space. So we invite members to use this space actively, to share what is working, what is not working, where support is required, to contribute to joint resources, and also participate in webinars and discussions that will really help shape regional priorities and strengthen collective preparedness and response capacity. As we begin, I would like to acknowledge the leadership of member states and the contributions of IFRC, WHO, UNICEF, and many partners who have helped bring this initiative to life. With that, I am pleased to welcome you once again to the launch of this Asia-Pacific Community of Practice on Community Engagement and Resilience. Now, I would like to encourage participants to introduce themselves and start engaging with each other by using the chat box. And in the chat box, you can state your name and the institution that you come from. Thank you so much once again. And I really hope that you find this webinar today useful. Now, I would like to open the floor for welcome remarks. And for welcome remarks, I would first like to invite Dr. Nilesh Buddha, who is the Regional Emergency Director for WHO Southeast Asia. Dr. Buddha, over to you.
Good morning, good afternoon, colleagues. It is my pleasure to welcome colleagues and partners joining us from across the Southeast Asia, Asia Pacific region to today's webinar to launch the Asia Pacific Community of Practice on Community Resilience and Protection. Thank you for taking the time to be with us and for your continued commitment to strengthening community resilience and public health emergency management. As we continue to face increasingly complex health emergencies, one lesson has become abundantly clear. Communities must be at the center of our preparedness, response, and recovery efforts. Communities are not simply beneficiaries of our programs, they are our trusted sources of local knowledge, health workforce foundation, and critical partners in building resilient health systems. When communities are meaningfully engaged and interventions are co created with them, they become more responsive, more equitable, and ultimately more effective and sustainable. Realizing this vision requires more than recognizing the importance of communities. It requires strengthening the capacity of the institutions and individuals that work alongside the communities, creating opportunities to learn from one another and fostering collaboration across sectors and countries. This is precisely why we have established the Asia Pacific Community of Practice on Community Resilience and Protection. By bringing together stakeholders from across this region, we can harness our collective strengths, coordinate our efforts, and accelerate learning, all in support of our shared goal of placing communities at the center of public health emergency management. Our COP, Community of Practice, provides an important platform to direct engagement with peers across countries to compare experiences, exchange practical solutions, and learn from both successes and challenges. Equally important, it creates opportunities to hear directly from those working on the ground, whose experiences and insights are invaluable in shaping policies and approaches that are practical, relevant, and responsive to community needs. It would be a key component of the envisaged regional health security platform to facilitate the implementation of the Banyan Framework for Health and Well-being in the WHO Southeast Asia region, which is for next couple of years, 2026 to 2028. I would like to acknowledge our co-leads and valued partners from IFRC and Red Crescent Societies and UNICEF for their continued leadership and collaboration in advancing community-centered initiatives across our region. If you have not yet joined the Community of Practice, I warmly invite you to become part of this growing regional network. For our existing members, I encourage you to continue actively engaging with your peers, participating in upcoming activities, contributing to discussions, and exploring opportunities for collaboration. The strength of this community lies in the diverse knowledge, experiences, and perspectives that each of you bring. Thank you once again for joining us today. I wish you a very productive webinar, meaningful discussions, and valuable learning that you can take back to your own programs and communities. Thank you and all the very best.
Thank you very much, Dr. Buddha, for those encouraging remarks. And now I'd like to invite Dr. Deepa Risal Pokhrel, who is the Senior Advisor and Global Team Lead on Demand for Immunization with UNICEF. Over to you, Deepa.
Hi, thanks, Rudrjit, and lovely to see so many colleagues here. Many of them I know, many of them are probably new, but really happy to be here with you today for this launch of the Asia Pacific Community of Practice on Community Engagement and Resilience Building. So as Rudrajit said, my name is Deepa and I lead the immunization demand team at the Global Health Practice based in Nairobi. So this community of practice is very timely in the sense that there is so much going on in the external environment in terms of how we are responding to public health emergency, but at the same time, how do we support the member states, the countries for continuity of the services? Because I think there has to be a nexus between how we are responding to emergencies, at the same time, how are we supporting the system strengthening in this, very difficult environment where a lot of misinformation is floating, a lot of access to social media is one of the key things that we are seeing. The value of the community of practice, as Dr. Nilesh already said, is how do we actually collectively respond and support the countries? And it lies in our diversity. So a couple of things as reflections, I would say, on behalf of UNICEF, which also leads the Global Vaccination Demand Hub, which is kind of a community of practice. So I was just thinking about what could be some of the lessons that we could share with you all from Asia Pacific region, which has always been one of the strongest regions in terms of community engagement and resilience building. So the community of practice is going to be the first thing which comes to our mind is that when it's a community of practice, we speak with the same voice, so that it mitigates the duplication of what we are doing. It's not useful when each of the organization or each of the partners is trying to do their own thing at the community, but what it has allowed us from past experience when it's a community of practice is to really make sure that whenever any tools or guidance are being developed or adapted from the global level, it helps to disseminate the same kind of content and the messages as well as the approach to support the country level colleagues. So that's one really big takeaway from the community of practice. The second thing, as already Dr. Nilesh said, is how do we share across the countries? It's not just one country that is coming together. There are so many different countries which are coming together, joining hands in the community of practice. How do we foster the peer-to-peer learning among countries, but also from partners? That's the second part. The third part is partnership, because if you look at how we are supporting the ministries of health, if each of us go with our own mandate, then it becomes very difficult for member states to respond. So I think it will really allow us to coordinate among ourselves whenever there is a technical assistance need at the country to respond, but also to prepare, but help them to continue the work for resilience building, which is going to be important. So those are a few things of the community of practice, which maybe I wanted to share with you all, so that maybe you can take some reflections on what may have worked in other parts of other community of practices. But just narrowing down to the community itself, as Rudrajit already said and Dr. Nilesh also highlighted very well, we need to really make sure that community is not by the way. So they are at the center of everything we are trying to do, and what UNICEF brings onto the table as a partner, which works very, very closely with WHO and to bring the intelligence from the communities. The first thing for community engagement starts with listening, as you know, and for us, children, adolescents are at the heart of the center. So with more than 450 dedicated social and behavior change specialists across the world, but also in Asia, which includes Asia Pacific region, we are able to bring in the community's voices to the policy dialogue, but also to share with what are the things that are being talked about, what are the conversations, what are the concerns that the communities have, so that we are able to collectively then think about what are the bottlenecks, what are the solutions that we can bring onto the table, so that it does not go as a fragmented approach when we are responding to the emergencies, but also for the broader public health issues. So the second part is the partnership. We already know that the three organizations have worked very, very well, and Asia Pacific has been quite an exemplar in that sense. Even starting from the COVID-19 days, I remember being in some of the regional technical working meetings where I was asked to speak about COVID-19 demand promotion when we were launching the vaccination. The third part is how do we then see that, okay, these are the bottlenecks that we are seeing. How can we better support the Ministry of Health? even when we are providing technical assistance. In some cases, WHO may be available in the country. In other cases, it may be IFRC. In other cases, it may be UNICEF, and it may be civil society organization. GSI does a lot of work. Academia also supports a lot of work at the country level. So how do we build onto the strength of each other and complement each other in a way that it goes as a solid technical assistance to countries? Finally, I would say that the community of practice would really enable us, as has been said before already, to listen to each other and also brainstorm about what could be the latest evidence which is coming from the global level. How can we then have a look at the subset for our region's nuances, the things that we see from a regional perspective, and then respond, whether it's adaptation of the global tools and guidance, or it could be regional tools and guidance that we may need to develop and disseminate and share. And also it provides a really great platform to provide orientations on any technical clinics that you may need to provide for the member states. With that, I would just like to say that UNICEF is very committed to the partnership and the community of practice, and with Rudrajit already being there in Bangkok co-chairing the community of practice, I wish all the best to everybody to make sure that it becomes a very strong community of practice as we support the member states in addressing the multiple things for public health emergency. Thank you so much, colleagues, for giving me the space to speak a little bit about the past experience, but also, very, being able to just share the reflections that we've had, which will hopefully help in thinking forward for the community of practice. Back to you, Rudrajit.
Thank you very much, Deepa, for the very practical suggestions and guidance from your end. Now I'll hand over to Dr. Sushma Bhushal, who is the Regional Thematic Lead for Health and Care with the IFRC Asia Pacific Office. Over to you, Dr. Sushma.
Thank you, Rudrajit. Thank you, everyone. Good morning, good afternoon, and good evening, distinguished colleagues and partners. It's a pleasure to welcome you to the launch of the Asia Pacific Community of Practice on Community Resilience and Protection, a joint initiative of the IFRC, WHO, and UNICEF. And on behalf of IFRC, we'd like to thank you for joining us. Today marks the beginning of more than a new platform. It marks the start of a shared commitment to strengthen how we learn, collaborate, and work together to support communities across the Asia Pacific and could be even beyond. The value of a community of practice lies in this ability to connect people who share a common purpose. Across our organizations, we have a wealth of experience, technical expertise, and practical lessons from working with communities in diverse settings. Yet, too often, these experiences remain within individual programs or organizations. This community of practice creates a space to bring that knowledge together, learn from one another, and translate experience into stronger policies, programs, and action. As we know, community resilience and protection are constantly evolving fields. New challenges, changing risks, and emerging evidence require us to adapt and innovate. Through regular dialogue and knowledge sharing, this community of practice will help us stay connected, strengthen our technical capacities, and promote approaches that are informed by both evidence and lived experience. We hope this platform becomes more than a forum for discussion. Hopefully, it becomes an active network that encourages collaboration, sparks innovation, and inspires practical solutions that can be applied across countries and contexts. Its success definitely will depend on all of us, our willingness to share openly, learn from one another, and continue our knowledge and experience. Thank you for being part of this important milestone. On behalf of IFRC, we look forward to the conversations ahead and to seeing this community of practice grow into a vibrant platform that strengthens our collective efforts to build resilience, protected and empowered communities across the Asia Pacific region. With that, I end my remarks. Thank you, and over to you, Rudrajit.
Thank you very much, Dr. Sushma, for your insights and your valuable suggestions. And now I'd like to invite Ms. Abigail Generalia, who is actually the pillar of the Community of Practice, to introduce us to the Asia Pacific Community of Practice on Community Resilience and Protection. Over to you, Abigail.
Thank you, Rudra. Just checking whether you're able to see my screen in full view. Okay, thanks,
Yes,
Haman.
we can.
All right, thank you. Good morning, good afternoon, colleagues. My name is Abby Generalia from the Community Engagement and Resilience Team of WHO Southeast Asia's Health Emergencies Program. It is my pleasure to deliver this presentation on behalf of the Secretariat composed of our technical teams at IFRC, UNICEF, and WHO. Now, as we've heard from Dr. Nilesh, Ms. Deepa, and Dr. Sushma earlier, their openings, there is a strong and shared recognition of why communities must be at the center of public health emergency management and why stronger regional collaboration is essential to advance this work. Now, building on those remarks, I'd like to spend the next few minutes introducing the Asia-Pacific Community of Practice on Community Resilience and Protection, what it is, how it will work, and how it will support this shared vision. Co-led by IFRC, UNICEF, and WHO, as emphasized earlier by our colleagues, this community of practice is intended to serve as a regional platform that brings together member states, development partners, technical experts, local organizations like civil society organizations and community-based organizations, academic and research institutions, and other stakeholders who share a commitment to advancing community-centered approaches to public health emergency management. The members work in the areas of risk communication, community engagement, community-based surveillance, demand for immunization, community workforce strengthening, infodemic management, social and behavioral sciences, and so on. We also have technical specialists and organizations working on programs supporting health emergencies, particularly during response. This include our colleagues working on public information, communicable and non-communicable diseases, One Health, universal health coverage, environmental health, disaster risk management, among others. To date, we have about 200 members, and we look forward to welcoming more into this community of practice. Now, with the Secretariat to coordinate actions, soon some technical teams, technical advisors to provide guidance, a digital platform that will facilitate communications and house resources, and soon also an agreed set of priority initiatives. It is anticipated that this community of practice will enable rich peer learning, facilitate rapid support, and the harnessing of collective resources for public health emergency management and for broader community resilience efforts. It aims to strengthen regional collaboration through the development and sharing of technical knowledge, coordinated action, capacity strengthening, regional priority setting, and advocacy for community-centered approaches to public health emergencies. Of course, a community of practice, as what was already pointed out by my colleagues earlier, it's only valuable as the opportunities it creates for its members to connect, to learn, and to work together. To bring this vision to life, the community of practice will support its members through 5 complementary areas of work, as you are seeing on your screen now. First, we will support regional capacity building by bringing members together to identify priorities, develop work plans, and strengthen skills through targeted learning opportunities. Next, we will foster continuous learning through regular webinars, workshops, trainings, and real-time technical discussions that will create opportunities for the members to learn from one another and exchange practical experiences. Number 3, we will collaboratively develop and create resources, from technical guidance and training materials to evaluation tools, other packages, so that members can both contribute to and benefit from our collective expertise. Fourth, during public health emergencies, the community of practice will help facilitate regional collaboration by connecting expertise, coordinating technical support, technical and operational support, and strengthening search capacity where appropriate. And lastly, we will continue to grow this professional community by strengthening partnerships, facilitating peer networks and advisory groups, and establishing collaborative initiatives, such as the Infodemic Management Alliance. Now, taken together, these initiatives are intended to make our community of practice more than just a platform for information sharing. Our aspiration is to build an active community where members continuously connect, learn, collaborate, and support one another, both during emergencies and the times in between them. Together, we have an opportunity to build a stronger regional community of practice that places communities at the center of preparedness, emergency preparedness, response, recovery, and resilience. Thank you very much for your time. While this has been a brief introduction, a very brief presentation, we hope it has given you a sense of the value this community of practice aims to offer its members. We'll have the opportunity to explore this further during the next part of the webinar, which is the panel and open discussions. With that, I'd like to hand it back to our host, Rudra. Thank you.
Thank you so much, Abigail. That was very useful, I think, for people to understand the nuts and bolts of the community of practice. And with that, I'd like to now hand over to Dr. Ruben Samuel, who is the Program Area Manager for Country Health, Emergency Preparedness, and International Health Regulations with the WHO Southeast Asia Regional Office, to basically expand on what members need and expect from this community through a panel and open discussion. So over to you, Dr. Ruben.
Thank you, Rudrajit. I hope I'm heard well. So we will spend about half an hour to 40 minutes, not more than that, to have this panel discussion. And it will be run in such a way that there would be also opportunity for all participants to also actively participate by providing their feedbacks. In addition to the questions that are responded to by the invited panelists. I am Ruben Samuel, as was introduced, Program Area Manager for Country Health, Emergency Preparedness and International Health Regulation in the WHO Southeast Asia region. So the objective of this panel discussion is to really look at not just perspectives, but also try to get members' engagement in such a way that we are able to clearly co-create the key priorities of the community of practice. So it will be a combination of discussion with panel members and also live audience participation. Before I introduce the panel members, there would be a live audience participation by answering the first question that will be put to you. So I ask Abhi and my colleagues to show the first question, the QR code, etc., on the Zoom screen and also in the chat, so that people can actually answer, and then the responses will be broadcast live as you respond. Over to you, Abhi.
Thank you, Dr. Ruben. So you are seeing now the live quiz platform. Rudra, can you see it now on your screen?
Yeah, we can see it on the screen.
Yes.
Right. So you can connect through the URL that's on top of the screen, and also through the QR code that is uploaded on the chat box. And you will also be seeing the QR code on my avatar. So you have different ways of connecting, and all of these are available as we move on. Dr. Ruben, back to you for the question.
Yeah. So let me read the question. Building on your experience working with various partners and other stakeholders, as well as the presentation that Abhi made related to the community of practices functionalities, especially the 5 functions, what do you think is the biggest challenge that this community of practice should and could help to address?
Please connect everyone, and we will share the screen again with everyone's answers after the first part of the panel discussion.
So, Abhi, do I wait for people to answer or do I proceed with?
We can proceed, Doctor. We will show it again later.
Sure. Okay. So you can keep answering while we actually move on with the panel discussion. So first, I would like to introduce our panel members. We have 4 panel members. The first is Dr. Vatacharan we usually call him Dr. Ten, who is the Deputy Director of Emergency Public Health Division of the Ministry of Health, Ministry of Public Health, Thailand. Ms. Tanden Wangmo, Program Officer, Health Emergencies Program, Communicable Diseases Division, Ministry of Health, Bhutan. Ms. Masniza Mustafa, who is the Head of Health, Mercy, Malaysia. And Ms. Inaja Abjalil, Regional Community Engagement and Accountability Senior Officer, IFRC Asia Pacific. So thank you very much for agreeing to participate and be the panel members for this important webinar. So let me proceed by asking my first perspective from Ms. Tanden Wangmo of Bhutan. So Ms. Wangmo, along with other member states and partners, Bhutan also endorsed the WHO Southeast Asia's Regional Strategic Framework for Community Engagement and Resilience when the Regional Committee of WHO was held in Paro. And this includes the establishment of a community of practice as one of the regional priority initiatives. So that it is beyond member states, and then all member states as part of the Asia Pacific region, the CRO region, can actually benefit from it. So from Bhutan's perspective, why is a regional initiative like this important? And what gaps or challenges that cannot be easily solved by working with stakeholders only at country level can be sorted out and can be helped and supported by such a regional community of practice? Over to you, Ms. Tanden.
Thank you so much, Dr. Robin. Am I audible?
Yes, please.
Yeah, thank you. So before I share the perspective from Bhutan, I would like to thank for the opportunity to be part of this panel discussion. So to share the Bhutan's perspective, a regional community of practice on community engagement and resilience is very important because, as you all know, that health challenges today are not confined by borders. Whether we are dealing with emerging diseases, zoonotic threats, or climate-related events, or public health emergencies, many countries are facing similar challenges. So rather than each country trying to find solution on its own, we can learn from each other and strengthen our collective response. So for Bhutan, this type of regional collaboration is especially valuable. We are a very small country with a very committed health workforce, but like many small countries, our human resources and technical capacities are limited. So at the same time, we have a strong community foundation that we can build on. For example, we have like Village Health Worker Network, along with multi-sectoral platforms such as MSTF, which stands for Multi-Sectoral Task Force for Health, and CBSS, which stands for Community-Based Support System, which plays an important role in connecting communities and addressing health and social issues. However, community engagement is not something we can strengthen only during emergencies. It requires continuous learning, new ideas, and sharing of experiences. So this is where a regional community of practice can add a real value. One important area is resource sharing. Every country has developed different tools, approaches, and lessons through their own experiences. So a regional platform allows us to share these resources, such as training materials, communication approaches, guidelines, and good practices, so that countries do not have to start from zero. So we can learn from what has worked, adapt to our own context, and then use our resources more effectively. And another important benefit is like peer learning and capacity strengthening. countries have different strengths and experiences. Like some may have more experience in behavioral insights, others in community engagement approaches or resilience building. So through mentorship, joint learning, and exchange of expertise, we can support each other and strengthen capacity across the region. So at the same time, a regional community of practice should not mean that every country follows the same approach. So the strength is that we can share common knowledge and resources while adapting solutions to our own cultural and social realities. So for Bhutan, this is more than just a platform for sharing information. It's an important opportunity to learn from each other, strengthen the systems we already have, and prepare our communities better for future challenges. Because ultimately, resilient communities are built within countries, but can become stronger when countries come together, share experiences, and support one another. Yeah, thank you, doctors. That's all from my side.
Yes, I think he might have got disconnected.
Yeah, he might have got disconnected. Okay, so since he got disconnected, probably let me just continue with the discussion. Thank you, Ms. Tandine, Ms. Tandine, for the valuable insights that you got, that you shared with us from the perspective of Bhutan. So just really moving on now to the perspective of our colleagues, from those who are working on the ground, from the institutions that are closer to the communities. We just really want to ask Ms. Mustafa on the experience of civil society organizations. So Ms. Mustafa, civil society organizations are often closest to the issues on the ground, as I mentioned earlier. Now, based on your extensive field experience, what would make this community of practice genuinely valuable for civil society organizations and other community-based partners who do not have that much opportunity to engage with people from other countries or from other regions?
Thank you, Abby. Thank you for the question too. So I'm just a brief introduction. You already introduced me, but I just want to say that it's not like extensive field experience. I mean, I have been deployed here and there, but I think during this session, I will be able to enrich this session by referring to some of my deployments experience. So to answer your question, Abby, I think I'm gonna have to list out 5 strong points on how the community of practice can be valuable to the society. So number 1, I feel like as a community of practice, it must be able to solve a real operational problem at the ground. Civil societies are usually busy responding here and there, and it's not just about meetings, virtual meetings like what we have, or meetings in the office, but I think it's very important that this community of practice engage with the community, especially the communities that are hard to reach. And also another point that I would like to highlight here is how to manage the volunteers safely. So if the community sees the COP has certain guidelines or practices, safe volunteer deployments, I think this will get a buy-in from the community itself to allow the COP to implement projects or programs within their society. And number 2, I think it also needs, as COP needs to be able to have a safe space for the communities to share failures. Especially, we always talk about success stories, and when we implement projects, when we meet with the community, we often find ourselves telling these stories, but it's not very often that we share our failures. I think it is also human nature to actually experience both sides of the spectrum. We share our success stories, and also at the same time, the COP need to be able to share the failure, what did not work before, and how we can actually get the community to find a solution together with them, how this failure might work in this community at this time. And sorry if I'm speaking too fast, but I have 3 minutes to chase. And also another thing to point out is it's okay to let the community see that we have failed in some areas, but we should not portray the image that we fear criticism. Let them have their feedback for us to improve. And also, my third point is the community voices need to be included. We have to invite or maybe community consultations from different groups of people in the community, grassroots organizations, youth leaders, let's say men's representative, women's group, and also local volunteers. I mean, usually we have our own set of volunteers, but I think we should also open this space of discussion with the local communities as well. And again, to build resilience, it cannot just be from the office. You really need to engage with the communities to be able to do this. And usually it's the community itself or people living with that risk that we are trying to address are the best source of information for the project that we want to implement. Number 4 is to practice, oh my God, I lost it, to practice practical resources. As a community of practice, we need to be able to come up with a simple design of toolkits, SOPs, and it has to be fitted well within the community for them to be able to use it during emergencies or during any public health interventions or emergencies. So if we produce something that is not complicated and can be well adopted by the communities, I can guarantee that this will be something that they will use or they will turn to when they need to, especially when dealing with unexpected emergencies within their communities. And number 5, I think this is my I would really like to emphasize a strong adherence to this actually for community to find a certain COP as a valuable addition to the community. I think we have to build the relationship, and this has to be done before the disaster happens. It's not like sometimes we have no choice but to intervene during disaster. But I think we have to build a stronger relationship before even the disaster happens, which means, this also relates very much to the trust within community to the COP. I mean, get to know your communities, what works, again, what works for them and what does not. And I think when we have a strong trust within the community, we will have, I don't know, I think things will just roll out as we plan because we get the buy-in from the community. So, and also by working together, all COPs together, like what Ms. Wang Mo from Bhutan has addressed earlier, we don't have to reinvent the wheel. It's already there. We just have to improve the wheel and make it work for that specific communities that we are working with. I think that's all from me, Abby. Thank you.
Thank you very much, and apologies, I had an internet outage. So thanks to Abby for picking up the slack. Now we will actually see the responses to the first audience question. Maybe Abby can put them up.
Can you see it, Dr. Ruben?
Yes.
For easier reference, we can actually group them together into themes now. So you can, to help synthesize the answers.
So these are the 3 broad boxes in which they have been kind of put together, or there is more. Resource sharing, okay. Learning and capacity building challenges. Okay. So essentially, I think this goes back to also what the first two panelists really highlighted. First, in terms of countries which are small and even countries which are medium size, there is the economy of scale in terms of technical capacity. So a regional forum is quite useful, and that is a challenge that it can really address. And also, as it was highlighted, no longer are emergencies within borders, but they always, especially the infectious hazard related emergencies, also span across borders, and thereby a regional forum such as this would address some of the things that are required for coordination, collaboration across countries. And also, as was highlighted by the second panelist, there's a whole lot that can be done in terms of connectedness, remaining connected, and also we need to really look at how this will not only help in capacity building, but also resource sharing and support mechanism, and also learning from, this was highlighted, not only the successes, but also the challenges and the failures. Sometimes post-response, we usually try to do a action review, and action reviews always throw up not just successes, though we would like to focus on the successes, but sometimes we are better off learning from the challenges we faced and the failures that we unfortunately faced. So those are things that and probably also, in addition to resource sharing, maybe the community of practice can also be a forum through which we can actually start mobilizing resources that are required, especially by the smaller organizations which are actually supporting the ministries of health, not at the national level, but really at the local level. So that local flavor is also quite important. So thank you very much for your very engaged response. Now let's move to the second part of the panel discussion, and I will start with Abhi. You can actually put up the second question for the live audience. Then after that, I will actually, once you put it up, then we will actually go to Dr. Ten.
It's on screen now, Doctor.
Yeah. What would make you continue to engage in this community of practice? So it's so that it's not just a one-off. So what will kind of attract you to keep engaged, not just as a passive recipient, or as people mentioned, not simply to look at what resources are available and make use of them, but be an active contributor as well, so that there is both give and take, on a sustainable basis. So that is the second question that you need to answer. So think through it, and then while you're listening to our panelists, you can also answer the question. So moving to Dr. Ten, Dr. Ten, we have seen a lot of communities of practice established and operationalized to promote collaboration and coordination across various stakeholders. As someone working with multiple partners for emergency management, we are sure that you have seen how some of them thrive while others fail to be sustained, especially in terms of their collaboration. So from the perspective of a national government focal point, and based on Thailand's experience, what factors do you think facilitate a successful community of practice and sustain it? Over to you, Dr. Ten.
Thank you, Dr. Robin. Good morning, good afternoon, everyone. So thank you for letting me join this discussion on behalf of Thailand. So heard your questions as a coordinator. So we should understand the nature, the structure, and the roles of different agencies that we need to work together. So if you know the nature of every agency that we need to work or call the job together, so the job you can move smoothly. And in the crisis event, I think the crisis emergency risk communication skills, it just recommends skill that everyone needs to learn how to communicate in the crisis event. So if you know how to communicate with other agency, so we can check or share or report the urgent data, the urgent situations quickly, correctly, and clearly. And to make it sustain, I think we need to share the goals that can solve the real problems in the country. So at the community of practice will be large if the members see that we can use the shared knowledge to fix the real problems, especially in the emergency phase, to making the data or the reporting system faster, to make the data more accurate, will give the workers a good reason to join and stay longer. And the second one, I think we need to building the trust and teamwork across groups when one agency alone cannot solve the health crisis. So from my past experience show that we need to have a clear teamwork among the government, the local groups, and the private sector, how to collaborate with the city or the operation together. The teamwork must be built on the trust so everyone can easily share the information and resource. And another one, to get government support and a good system. The community of practice should not just be a short-term volunteer activity. We need a real support and a clear role from the central government. Let's give the workers the time, the space, the tools that they can need and meet to learn together. And from example from Thailand faced with the infectious disease outbreak at the border area. For example, the malaria disease outbreak, the dengue outbreak, or tuberculosis. So I think I, as a coordinator to do a community of practice, had to work under the outbreak situation. We need to make us strengthening the teamwork, that we need to work with different groups. We need to connect with the health worker at the local area, at the central area to work together and connect to the organization at the border. So another one is, I think, is about the doing public infodemic. We need to address the fake news that can be very dangerous about the outbreak. So if our team work with the local leader, work with the media station to stop the fake news, I think that is the important one. So that's all for my side. Back to Dr. Lubeng.
Thank you very much, Dr. Ten. And so we will move on to Ms. Senaja Jalil, the IFRC representative. And so, you've heard all these insights, not only from the panel members, but also from the audience. So how do you think that the Secretariat for this community of practice ensure that this COP remains active, practical, and responsive to members' needs, given that there are quite a few examples, quite a few expectations, and of course there would also be challenges. So given all of these things, how can the Secretariat play its role in making this very responsive and to members' needs, not members only at the national level, but across all levels of the country and the region. Over to you, Ina.
Hello, everyone. Thank you so much, Ruben, for the questions, and thank you also to all the panelists for sharing your valuable perspective and also expectations. I mean, as a secretariat, I feel those expectations are something that we work on. We will try to meeting that expectations. But coming back to the questions, of course, from the secretariat perspective, our role is to create an environment where people feel safe. Like Ms. Masniza mentions, that we can share about our failures. And also, as Ms. Tandin mentioned, that we can connect and learn from one another and, work together to strengthen the community resilience and protection across the regions. I just want to echo what Rudra mentioned earlier, that a community of practice is strong as its practices, but I also want to add that a community of practice is also strong as the value it creates for its members. So for Secretariat, I think for us, the first thing that we have to do is actually listening to our members. We want to continually understand what challenges, like mentions, any real challenges that the civil society actually face on the grounds. So what are the topics that are most relevant to them, and how these community of practice can best support their work. I mean, of course, their feedback, the members' feedback would very valuable to us, and it should guide how this community of practice evolve. And as we recognize that everyone has competing priorities, so every webinar, discussion, or resources should provide something useful and practical and relevant that members can take back and apply in their own work and context. Regardless whether there's a practical tools, as mentioned a lot by the panels, that lesson learned, country experiences, opportunity to solve common challenges together, and also opportunity to collaborate, between organizations, sectors, countries. Yeah, so I think as we know that there is already a wealth of expertise and experience within this region. So the secretariat role is actually to bring people together to facilitate the knowledge exchange and again create the opportunity for members to connect and learn from one another across country, across organizations. And actually we have started doing some of this by creating ways that members can engage, as Abby already presented some of the ways that we are going to engage with the members essentially. But some of the things that we have done actually, for example, to this webinar, and we have created a thematic WhatsApp groups that the members can join. And we're also developing our resources bank that the members can actually both use and contribute to. So I think this is actually something that we aim to do moving forward. And we hope this community of practice become more than just a series of webinars and discussions. So we want it to become, again, a trusted community where members can actually contribute and share experience and support one another in strengthening the community resilience and protection within this region. Yeah, that's all, Ruben. Thank you. Back to you.
Thank you. Thank you very much for those very practical suggestions. And now Abhi will actually show us what our audience of the webinar thought about question number 2, which is related to how to keep engagement sustainable and sustained. Yeah. So I think the main topics are how to, that the community of practice should not just be an information exchange, but rather focused on problem solving, try to address what people face while engaging with communities and working with communities, and then what are the problems that need to be solved, and also opportunities for building their own capacity and learning, plus also that it needs to be relevant for not just emergency preparedness, but also, as Abhi also mentioned in her presentation, in between emergency response, which will actually include both emergency preparedness, but also regular healthcare delivery, because many of you would also be involved in health promotion and other such activities. Then how do we kind of, coordinate our work? And of course, an opportunity to have resources that people can actually use, which are practical, especially from the context of not having to reinvent wheels. And this we keep seeing often, especially whenever a new disease comes. And I also find it when we have recurrence of age-old diseases, whether it is dengue or cholera or whatever, then it might be new to a particular country or a particular subsection of the country, and then everybody is scrambling for these resources. So the community of practice should make available all resources. And now with more IT tools, etc., it might also be possible to present it in a way that it is easily accessible and easily cataloged, etc., so that people can access these things quite easily. So yeah, thank you very much for these insights. Now let's go to one more question from the live audience because there's not much time, so I cannot actually ask any follow-up questions to the panelists. But let's actually at least have the live audience question. And that is the second thing that I mentioned in terms of the engagement, not just be passive recipients. How would you like to contribute actively to this community of practice? What are the various skill sets, various experiences, various insights, perspectives, knowledge, capacities that you would like to bring to the community of practice? So please get going on this. So if while people are answering that particular question, I would like to address this question to Ms. Tandon, Dr. Ten, and Ms. Mustafa. If you could just request just one thing from this community of practice over the next 1 year, top ask, top request, from the various menu of expectations and asks, what would that be? So quick fire answers. First Ms. Tandon, then Dr. Ten, and then finally Ms. Masniza. Top ask.
Yeah, sure. So I'll be very quick. So if I could request one thing from the community of practice over the next year, it would be to establish a strong mechanism for continuous peer learning and resource sharing, because for Bhutan, the greatest value is the opportunity to learn from other countries, share our own experiences, and access practical tools and expertise and best practices. So that's it from my side. Yeah, thank you.
Thank you. Thank you very much. Dr. Ten?
Yeah, for me, I would ask for us to build a ready-to-use resource hub for our region. This hub should have an easy-to-read lessons or tools. Then when the crisis happens, member countries can just take these guides or this tool to use them right away right now. So I think it will help us to save time and help protect people's life much faster. Thank you.
Thank you. Thank you very much, Dr. Ten. So one is connection, the other one is resources. And what's your ask, Masnita?
It's always as the last speaker, right? So I think what I would request from the community of practice, if we could move the collaboration from being project-based to relationship-based. I think we all work together in the same humanitarian space, but we think that we work together, but actually we work parallel to each other. So I think building the community relationship is essential to make sure that all these NGOs or civil societies are actually working together for the betterment of the community, not for our own. So I feel like from project-based to relationship-based, we have to make that shift. Thank you.
Thank you. Thank you very much. I think when in the earlier days when we were building up virtual networks, one of my mentors used to say that virtual networks are only as strong as the physical networks in terms of the relationships that people actually build. So hopefully now, we will be able to use the virtual platform itself and also all the other opportunities that it presents in terms of, meetings, etc., to move from projects and programs to relationships, so that it's a vibrant group of practitioners who really know each other and can relate to each other, and also can kind of reach out to each other when needed to problem solve, to share, and to support. So thank you very much for these very useful asks. Now Abhi will now project again the response to the third question. Okay. So people would say that they could share their knowledges and best practices, they can collaborate and community, make sure that the on the ground listening to hear on the ground and also share the voices from the community and practical experiences, including tools, evaluation and monitoring products and things like that, etc. Okay, that's great. So I think maybe some of them would also be along the lines of some people are involved in risk communication, some are expertise in behavioral insights, others in infonomic management, etc. So it will probably be technical domain specific, but also in terms of where you are engaged and what you are actually good at. So thank you very much for these insights, and I hope we can hold you to it, so that the community of practice is not just a repository where people take, but also a place where people can actually contribute actively and participate. And as was told by the last panelist, that we can actually build relationships. So thank you very much. And I now hand over to Rudrajit for concluding remarks.
Many thanks, Dr. Reuben, Abigail, and panel members and participants for a very engaged discussion. We really hope that today's discussion has given you a clear sense of the value that this community can bring. Before we move on to the final closing of this webinar, I'd just like to invite all of you to turn on your cameras so that we can take a group picture of everyone joining in today. And Abigail will facilitate that process of having the picture taken. Thank you very much. Does everyone have their cameras on? Yes, I see a lot of people have turned them on. Thank you so much. Abigail, over to you.
Okay, now, Rudra.
Sorry?
Okay, now.
Okay,
Yeah,
done?
go ahead. Yeah.
All right. Okay. Thank you so much. Thank you so much, colleagues. So before we close, we'd just like to spend a few more minutes looking ahead to give you a preview of what's coming next and how you can take part in these activities that we've planned. We shall also be sending you a survey very soon, which will further inform our priorities in the coming few months. So as you can see, we already have an available community of practice, and that's currently available on WhatsApp as well. You can access that community of practice through WhatsApp, make best use of the resources. And very soon we'll have a comprehensive list of, hazard-specific public communication materials, which includes different types of materials like posters, social media cards, and so on and so forth. And we also have a couple of upcoming webinars. A lot of you spoke about the importance of knowledge sharing and exchange. So we'll have the launch of the regional social listening dashboard. We will have a webinar on community health workforce strengthening, and a package has been developed on that. So we'll introduce that package to the webinar. We will have webinars on generating and using social and behavioral data, and also on the Community Trust Index. And we'll be sharing information on these webinars very soon with you through the WhatsApp channel and also through emails. So like I mentioned, we already have the WhatsApp community groups. So currently we have 7 groups that have opened up on the WhatsApp community. So basically these are designed to bring together all of us with shared interest, experiences, and areas of work. And it's just an attempt to make it easier for us to just connect, exchange ideas, and collaborate on topics. We also have group discussion guides that are available, and these basically indicate which topics are best suited for each group. And all community of practice members are welcome to join just about any group that you're interested in. And basically it could be your own personal interest or it could be a professional focus. Please just feel free to join any group and contribute and learn from the group. And we really look forward to everyone's active engagement in these different groups. And just in case you've not already joined the community of practice, we have this QR code here, which we'll leave on for a minute. You can scan that and then you can join the community of practice. And the existing members, I think you've already received an email. It's a welcome email from the email address on your screen. And that email will also include this QR code to join the WhatsApp community. So just in case you can't click the QR code in time, you will also have it in your email through which you can join the community. So thank you very much. And it's been great having all of you with us today. And let's just say that today's launch is not the end of a planning process, but it's the beginning of a shared journey. It's our journey together. And it is our ambition that this community becomes a really practical and it becomes a mechanism that helps us learn faster, coordinate better. And we at IFRC and UNICEF really look forward to the collaboration, learning, and collective action that this community will make possible. So thank you so much. It's been lovely having you with us, and look forward to connecting with all of you soon again on our webinars and other pieces that we'll be coming up with. Thank you so much and have a great afternoon.